Ooh. Let me do something quick. Okay, I think that's good. That's also good. Yeah, that's fine. Okay, so we're gonna be studying again today. I had like the worst traffic coming home. It was so annoying. But it's okay, I'm here. And I had coffee today for the first time in like a while. And I feel more exhausted than I usually do. I think it's because of the coffee. I think it's because of the crash after the caffeine, you know? The questions. Okay. Let's see how we do today. Okay. Fundamental units of the nervous system are the neurons. Tests performed on plasma samples are collected in anticoagulant tubes. Yes, because plasma has a tube containing anticoagulant must be spun in a centrifuge to obtain plasma for testing. Most coagulation tests, for example, are performed on plasma obtained from light blue top sodium citrate tubes. Hematology specimens are collected in lavender top tubes containing anticoagulant EDTA, but the tests are performed on whole blood, not plasma. Serology tests are usually performed on serum. Blood collected in red, light gray top tubes will clot, and clotted blood yields serum, not plasma. The patient asks if the specimen about to be drawn is for a diabetes test. How should the question be answered? If the test is for glucose, say yes it is. Say it's best to discuss that with the doctor. Say no even if the test is for diabetes. Tell the patient that you don't know. I think it's say it's best to discuss that with the doctor. There are many reasons why the physician will order certain tests. Any attempt to explain why a test is ordered may mislead the patient. For example, a glucose test may be ordered because the patient is taking medication that can affect glucose levels, not because diabetes is suspected. Usually such inquiries are handled by explaining that the doctor has ordered the test as part of the patient's care and that he or she will be happy to explain the test if asked. The Health Insurance Portability and Accountability Act clearly states that patient confidentiality must be protected. This does not apply to inquiries by patients about their own tests. Okay. True or false? The epicardium contracts to pump blood into the arteries. Sounds true. Sounds true. False! The epicardium covers the heart and attaches to the pericardium. Ugh. A buccal swab can now be used for the diagnosis of herpes simplex. It's either that or tuberculosis. I think it's herpes. Yeah. Buccal swab. This method of collecting a sample offers a rapid and sensitive way to test for specific DNA using polymerase chain reaction testing. PCR is a type of testing that can detect pieces of DNA from viruses such as herpes. The primary duty of a phlebotomist is to collect blood specimens. Which of the following bleach dilutions is recommended for cleaning the surfaces of contaminated specimen collection areas? I think it's 1 to 10. Yeah. Yeah. Phlebotomist has attempted twice to draw a partial thromboplastin time specimen from a patient with difficult veins. Both times the phlebotomists have been able to draw only a partial tube. What should the phlebotomist do? Collect the specimen by skin puncture, have another phlebotomist attempt to draw the specimen, pour the two tubes together and mix well, submit the fullest tube for testing, noting the draw was difficult. I'm choosing between B and D. Have another phlebotomist attempt to draw the specimen and submit the fullest tube for testing, noting that the draw was difficult. I think it's B. Yeah! A phlebotomist should never make more than 2 attempts at venipuncture. That's a 2-poke rule. 2-poke rule. After the second attempt, another phlebotomist should be asked to collect the specimen. This hospital department provides therapy to restore patient mobility. Physical therapy? That's what James is going towards. Hell yeah! Woo, physical therapy! Physical therapy department provides many types of assistance to patients who have physical handicaps, including therapy to restore mobility. The cardiodiagnostics department provides diagnosis. Okay, whatever. True or false? ABG syringes are usually pre-treated with EDTA to prevent clotting. False. It's heparin. Not pre-treated with EDTA to prevent clotting. EDTA may alter results, especially with pH. These are These are oval or rod-shaped organelles that play a role in energy production. Mitochondria? Mitochondria is the powerhouse of the cell. This is information that is relevant. Golgi apparatus. Lysosomes and ribosomes are all organelles. Mitochondria are oval or rod-shaped and are the site for energy production. The Golgi apparatus comprises layers of membranes that make, sort, and prepare protein compounds for transport. Lysosomes are small sacs of enzymes that digest substances within the cell. Ribosomes are tiny bodies that play a role in assembling proteins from amino acids. So both the Golgi apparatus and ribosomes have something to do with protein, and lysosomes have to do with enzymes and digesting. Good enough for me. In specimen handling, it is very important to appreciate that effects of mishandling the specimen are not always obvious. Centrifuging specimens are considered to be error-free. Most laboratory errors occur in the post-analytical phase, or the quality of results is not affected by a collection procedure. What? Hold on, I need to reread this. In specimen handling, it is very important to appreciate that effects of mishandling the specimen are not always obvious. Centrifuging specimens are considered to be error-free. Most laboratory errors occur in the post-analytical phase. No. The quality of results is not affected by collection procedure. I think none of these are true. They don't sound true. I don't understand what's going on here. I don't understand this question. I don't think any of these are true. And I feel like I'm just reading them wrong or something. Important to appreciate that effects obvious. Important to appreciate centrifuging error-free. Most laboratory errors occur in the post-analytical phase. Quality of results is not affected by a collection procedure. I don't know. This one's hard. I'm gonna have to throw this question. Let me see. Shoot. Proper collection procedures, including specimen handling, are important for quality test results. Testing personnel may not be aware that the integrity of a specimen is compromised because effects of mishandling are not always obvious. Most effects of mishandling cannot be corrected. It has been estimated that 50 to 70% of all lab errors occur in the pre-analytical phase. Oh my god, I'm so hungry. Hepatitis B vaccination for adults normally involves a first shot of vaccine, one a month later and one 6 months after. The first, I think it's this one. Single shot of vaccine, 3 shots of vaccine, 1 3 months apart. 2 shots of vaccine, 6 months apart. No, I think it's A. Yes, because that's how. Because I had to get my hepatitis B vaccine, and I still have to do the 6 month one. Your patient is not in the room when you arrive to collect a timed specimen. The patient's nurse states that the patient will be unavailable for several hours. What should you do? Ask the nurse to have a patient brought to the lab when the patient is available. Fill out a delay slip stating you're unable to collect this specimen. Report the situation to a supervisor and tell him or her to cancel the request. Return to the lab and put the request in the stack for the next sweep. No, not this one, not this one. I think fill out a delay slip saying you're unable to collect the specimen. Yeah. It's almost never tell your supervisor. Like they're like, don't bother your supervisor. They don't want you to bother your supervisor. So that's just like almost never the answer. True or false? Mononucleosis test is used for lymphatic system disordered. I don't know. False? Damn it. True. Mononucleosis test is used for disorders. Okay. The extrinsic or contact activation coagulation pathway is initiated by tissue factor released from injured tissue? Yeah, because extrinsic means that it's coming, the damage is coming from outside of the blood vessel. Like you get cut or something. But intrinsic means it's coming from inside the blood vessel. Right? I don't really know an example of that. So don't ask. These are the initials of the organization that instituted and enforces the bloodborne pathogen standard. Disease control? I think that's that one. Damn it! It's OSHA. The BBP standard was instituted by OSHA when it was determined that healthcare employees face a serious health risk as a result of occupational exposure to bloodborne pathogens. The standard is part of a federal law and OSHA is responsible for its enforcement. The main principles involved in radiation exposure are refrigerate, dose, and shelter, distance, shielding, and time, source, amount, and duration, or strength, location. I think this one. Yeah. The balanced or steady state of the body is called homeostasis. This is permanent computer memory that instructs the computer to carry out user-requested operations. I think it's wrong. We used to think it was RAM, but apparently it's ROM. I think that's kind of old school, though. Which needle gauge has the largest lumen? Which of the following substances is contained in a serum separator tube? I think thixotropic gel. Yeah, because all of these are in anticoagulant tubes. Which is another term for the OSHA hazard communication standard? The right to know law? A person who has recovered from a particular virus has developed antibodies against that virus is said to be immune. What is performed when completing a delta check? Check the medical record to ensure that the laboratory test was prescribed. Compare the current results with a previous result from the same test on the same patient. Compare the current results with a previous result of the same test on a different patient. Review the medical record to determine if the test is appropriate. for the patient's diagnosis. I think it's to compare the current results of the previous results of the same test on the same patient. Mixing equipment from different manufacturers can result in carryover of an additive, improper fit of the needle, wrong choices of additives, or all the choices are correct. I'm just gonna say, oh, okay. Improper fit of the needle. I don't know, man. I've never got this question before. A peak drug level screens for toxicity of the drug, becomes the therapeutic level, identifies the half-life of the drug, occurs just before the next dose. Not that one. I think screens for toxicity? Yeah. Therapeutic drug monitoring, I have to do that for my lithium, is performed to determine and maintain a beneficial drug dosage for a patient. Peak drug levels represent the highest serum concentrations of a drug and are collected during TDM to screen for drug toxicity. Which of the following abbreviations represents a test that is typically part of ABG evaluation? PaO2? Yeah! Arterial blood gas components commonly measured include PaCO2, pH, and PaO2. H2O measures water, and APPT is activated partial thromboplastin time. Activated partial thromboplastin. Or APPTs that characterizes coagulation of the blood. Okay. Which of the following basic tissue types covers and lines organs, vessels, and cavities? Muscle? Epithelial. I was thinking between those two. I'm not lying. Epithelial tissue types covers and lines organs, vessels, and cavities. But I was thinking it was smooth muscle. Connective tissue supports and connects all parts of the body. Muscle tissue contracts to produce movement. Nerve tissue transmits electrical impulses. Whatever. Mastectomy is the medical term for breast removal. Which of the following is a skin test for tuberculosis exposure? PPD? I don't know. Yay! I guessed right. The test for tuberculosis exposure, the tuberculin test, is also called a PPD test because, or TB test, is also called PPD test because of the purified protein derivative used in testing. The cocci test is for infectious fungus disease caused by coccidioides, imitas, and the histotest detects present or past infection with the fungus Histoplasma capsulatum, and the stick test is for susceptibility to diphtheria. Interesting. Okay, so the PPD test is the TB test. Just remember that. An internal process focused on identifying and minimizing situations throughout the organization that pose danger to patients and employees is performance improvement plan, decision criteria for accreditation, facility-wide risk management, or the Delta check procedure. Okay, it's not B or D. I think it's C. Yeah, facility-wide risk management. Pathogen responsible for causing an infection is called the infectious agent. Yes. Which immunology test detects rheumatoid arthritis? What class is this for? Hey, hi, Jimothy. How are you? This is for phlebotomy, aka taking blood from people. And I'm studying for my final exam, like the one that's gonna give me my certificate or my certification. And I'm stressed. Nice? Yeah, it's fun. I kind of like studying for it. Rheumatoid arthritis. EMV. I'm going between EBV and RF. I'm gonna guess. Damn it! I always do that. I like say, oh, it's either this one or this one, and then I guess the wrong one. Rheumatoid factor. I was thinking that R stood for rheumatoid. I'm stupid. Is an antibody that is found in rheumatoid arthritis and is an immunoglobulin EBV tester for harm serology and department and uses this type for a viral condition. Okay. A phlebotomist has tried 2 times to collect a pro-time specimen from a patient with difficult veins, plugging a partial tube each time, which is a protein reaction for the phlebotomist to take. I didn't I get this question already. Ask another phlebotomist to attempt to collect the specimen, pour both tubes together and submit the pooled specimen for testing. Submit the fullest tube with a notation that says that it was a difficult draw, or try one more time to collect it using a smaller volume tube. I'm gonna say ask another phlebotomist because I already know that's the answer. Some individuals lack the necessary mucosal enzyme to convert which of the following sugars so that it can be digested. It's either glucose or lactose. Yes! Yes, I guessed the right one this time. I was like, I think it was lactose, because it was like lactose intolerance or something. Milk sugar, lactose, is converted by the body into glucose and galactose by the action of an enzyme called mucosal lactase. A person lacking this enzyme has gastrointestinal distress and diarrhea when milk and other lactose-containing foods are consumed. Symptoms are relieved by eliminating milk from the diet. Lactose intolerance. An acceptable routine blood smear has a feathered edge. Yes. Which is the purpose of warming the site before skin puncture? It is comforting to the patient, it increases blood flow up to 7 times, it makes the veins more visible, or it minimizes smallest symptoms. I think it increases blood flow up to 7 times. Yes. Which suffix means formation? I think by process of elimination, I think it's poliosis. It's either poliosis or yeah. Yeah, poliosis. Because I knew the other ones weren't formation. Like osis is like condition of or disease or something like that. Forgot which one. And then like ia is like, no, I think osis is disease. Ia is condition of. And then ium, I forgot. I don't remember that one. A urine CNS is typically ordered to detect presence of a UTI. Hell yeah. Submit test. Let's see how we did. Okay, we're gonna see how we did. We got 70%. What the hell? I need to do better than that. What the hell? I'm mad. I'm mad. We got 85% and 83% at some point. We can do better. We can do better. We can do better. Let's do 50 questions instead of 40. I feel like 50 is a rounder number than 40. I just like doubled it from 20. Okay, whatever. I'm so hungry. Okay, let's go. Okay, required parts of an exposure control plan include an exposure determination, communication of hazards, isolation procedure policies, or methods of implementation. Required parts, communication of hazards? I'm just throwing it now. I'm not even caring. To comply with OSHA standards, an exposure control plan must contain exposure determination, communications of hazards. Oh, exclude! I'm stupid! Oh my god. Read the question. Read the question. Read the question. Which of the following additives prevents coagulation by inhibiting thrombin? I think it's EDTA. I want to say it's EDTA. I think like heparin removes calcium or something like that. It like bonds to the calcium so that it doesn't. I'm like, damn it! Ah, fuck you. Heparin sulfate, closely related to heparin, is naturally occurring anticoagulant that helps prevent clots within vessels. Fuck me, dude. I'm throwing this one. Which of the following can be refrigerated after testing? Bronchoalveolar lavage? Serous or all of these. Yes. BAL, serous, or synovial, and CSF can be refrigerated after testing. BTT will most likely be discontinued if the patient vomits 15 minutes after the test starts, drinks water before or during the test, is unable to provide any urine samples, or walks around too much during the test. I think it's vomits. Yes. Ah. A phlebotomist is about to collect an arterial blood gas specimen. The phlebotomist is feeling the thumb side of the wrist in an attempt to locate which artery? The radial artery. The other side is the ulnar artery. But you never poke that one. A phlebotomist is told to take procedural shortcuts to save time in collecting specimens during morning sweeps. She disagrees and chooses to follow the rules. Which professional characteristics? Integrity. Hell yeah. True or false? A good way to avoid lawsuits is to consistently perform venipunctures as rapidly as possible so that you get the results sufficient. False. Better to be accurate and not bad. When is the best time to release a tourniquet during venipuncture? After the last tube has been filled completely, after the needle is withdrawn and covered, as soon as the blood begins to flow into the tube, as soon as the needle not B. It's not D. I think it's C. Yes. Because according to the CLSI guidelines, the best time to release a tourniquet is as soon as blood begins to flow into the first tube. Releasing the tourniquet, as well as having the patient release the fist, minimizes the effects of stasis and hypnomal concentration on the specimen. Tourniquet should not remain in place longer than 1 minute. Okay. We don't really do that. We usually wait till the last tube. Just to keep the flow going, because usually it helps with like keeping flow steady. Which of the following is not included in the various phases of malpractice litigation? A complaint against the defendant is filed by the plaintiff. A healthcare institution is informed of an injury to a patient. Appeal of the jury decision is begun by the losing party. Depositions are given while a court reporter records every word. I don't know. This is a tough question. I think it's either B or C. I'm gonna say C. Damn it! Why do I do that? I keep doing that. It's freaking annoying. Of the various phases of malpractice litigation, including... Okay. Which of the following 3 tests are most affected by hemolysis? I don't know. Potassium... Maybe potassium. Yeah, I knew potassium was one of them. That's the only reason I got it. Okay, potassium, magnesium, and CK. Okay, I can remember that. Just remember potassium is greatly affected by hemolysis. Lidocaine is sometimes used during arterial puncture to anesthetize the site prior to the puncture, help dissolve air bubbles in the specimen, keep clots from forming in the specimen, or maintain the specimen in an anaerobic state. I think it's anesthetize the site prior to the puncture, because that's what lidocaine does. What would be an advantage in using the brachial artery for an arterial blood gas specimen? The artery is large. It is a preferred site, easier to locate in an obese patient, and blood clots faster from the location. It's not D. It's not B. The artery is large. Yeah, it is large. The radial artery is the preferred site, but it's pretty small. Like for an artery, it's pretty small. Brachial artery is difficult to locate in an obese patient. Okay. Which of the following word parts means recording or writing? So much info. I know, dude. This is like, it's like my whole semester put into one. it's so much information. It's 14 chapters of information put into one. And I'm stressed. Which of the following word parts means recording or writing? I think it's gram. Yes. True or false? In a routine ETS venipuncture evacuated tube system, the red tube should be drawn before the green tube. True. Yes. Order of draw. Order of draw is hard. I mean, I got kind of used to it, so it's a little easier now. But like additives and like which tests need which tubes, those are hard. Because that's just memorization. I'm bad at that. A first morning specimen is preferred for HCG testing because it is typically more concentrated, more apt to have high pH. Typically more concentrated. I was like, it's not less likely to be contaminated. So I was like, it's not all of these. Okay. A chain of custody is a special protocol used when collecting forensic specimens, necessary in patient management for therapeutic phlebotomy, required for the POC quality assurance program for nursing, or part of the type and cross match procedure for blood bank. I think it's a special protocol used when collecting forensic specimens. Yes. So that's all like legal stuff. You know what I'm saying? A hematoma is a blood clot inside a vein, pool of fluid from an IV, swelling or mass of blood, or symptom of nerve injury. I think it's swelling or mass of blood. Hematoma. It's basically a bruise. Basically. But it can be worse than that. Platelet plug formation takes place in this phase of the coagulation process. Propagation? Initiation! God damn it, I was like, it's definitely not initiation. I actually don't know this because I was gone. I was in Texas during the week of this subject. So I had to learn it on my own, and I think I missed some of the info. Ugh. Okay, platelet adhesion and aggregation take place in the initiation phase of the coagulation process, which results in the formation of the platelet plug. The amplification and propagation phases involve the formation of the stable blood clot called the hemostatic plug. Termination of coagulation is the end result of the propagation phase, and also the work of natural inhibitors. Hemostatic plug. Okay. Stable blood clot. This is the stable blood clot. This is the initial plug. The platelet plug is the initial plug. Okay. Why are EDTA specimens obtained before other specimens when collected by skin puncture? I think to minimize the effects of platelet clumping. Because it, like, your finger, if you do a finger stick, it, like, I think it, like, clots faster. Because it's a cut. That's, like, there. Blood smears and EDTA specimens are collected before other specimens to minimize the effects of platelet aggregation or clumping. When tissue is disrupted by skin puncture, the coagulation process is set in motion, and platelets start to aggregate, stick, or clump together and adhere to the site to seal off the injury. This can lead to erroneously low platelet counts. Platelets are evaluated and their numbers estimated as part of the differential performed on a blood smear. Platelet count is part of a complete blood count performed on an EDTA specimen. CBC, complete blood count. The temperature of heel warming devices should never exceed, I think it's 42 degrees Celsius. I only know that because the bear huggers at work for like my vet stuff is they go from like 40 degrees Celsius to 48 degrees Celsius. So I figure that like a warming device should be around 40 degrees Celsius. So that's why I guessed 42. I didn't actually know the answer the first time I saw this question. So I guessed 42 and I was right. So that's how I remembered it. Which body cavities are separated by the diaphragm? Abdominal and thoracic. Yoink. A medical term ends in NX. How should this term be written as plural? I think Nx says. What the fuck? The plural for the term that ends in NX is NGES. Oh, okay. Okay. I can remember that. Which of the following tubes or additives is sometimes used to collect DNA tests? DNA tests? See, this is like the ones that I'm bad at. I want to say yellow, but I don't know which one. I want to say... But, bruh, I keep doing that. It's so annoying. The yellow top tube containing ACD solution is available in two formulations, solution A and solution B, for immunohematology tests such as DNA testing used in paternity evaluation. The acid citrate prevents coagulation by binding calcium with little effect on cells and platelets. Dextrose acts as a red blood cell nutrient and preservative by maintaining RBC viability. Dextrose. Oh, it has dextrose? ACD. Huh. Interesting. Okay. The manufacturer must supply a safety data sheet for isopropyl alcohol. Yes. I was like, is it isotonic saline? But I was like, no, I don't think so. The ability of platelets to stick to each other is called platelet adhesion? Aggregate. Bitch, I'm so fucking pissed. I'm gonna do terrible in this one. Which of the following is an example of a work practice control that reduces risk of exposure to bloodborne pathogens? Ordering self-sheathing needles, reading the exposure control plan, receiving an HPV vaccination, or wearing gloves to draw blood. A work practice control? I don't know where. Love the MSDS question. Which one was that? I think wearing gloves to draw blood because it's like that's like a work practice. This is something you do outside of work. Yeah. Okay. That was hard. Which gland is most active before birth and during childhood? Pituitary? Thymus! I don't know these things. Dude. The thymus gland, located in the chest behind the sternum, functions in the development of immunity and is most active before birth and during childhood until puberty, when it begins to shrink. Oh, I like read that wrong. I was thinking it was like before giving birth. What's wrong with me? I think I still would have guessed it wrong, but actually no, maybe I wouldn't have it. I don't know. The period within which an injured party may file a lawsuit is known as binding arbitration, litigation process, statute of limitations, or discovery period. I think. I don't know. Statute of limitations. These questions are hard. Statute of limitations is the particular number of years within which one party can sue another. Binding arbitration is a way that equitable settlements cover a controversy over a controversy are made outside the courts. It is one of the pathways used in the litigation process, which is defined as a course of action used to settle legal disputes. One of the steps in the litigation process is the discovery period. Well, that's not a lot of information, but it gives a little bit of information about all the other. The abbreviation for a national agency that sets standards for phlebotomy procedures is the, I think, CLSI. Yeah. Laboratory Standards. Formerly known as the National Clinical and Laboratory Standards Institute. Yes. Standards. Laboratory standards. Just remember that. What is needed to accurately determine specimen collection times and time certain tests? A wall clock, a watch with a sweep second hand or timer, a digital timer on a mobile phone, or a manual count by the phlebotomist. I think a watch with a sweep second hand or timer. Yes. Collection time is needed to accurately determine specimen collection time and time certain tests. Simple compounds are transformed by the body into complex substances in the process called anabolism? Yes. Isolation procedures are used to separate patients from contact with others if they are a carrier of a bloodborne pathogen, have highly transmissible infections, require blood or body fluid precautions, or were exposed to a contagious disease. I think it has to have highly transmissible infections. An additive should be mixed after the next tube is placed in the tube holder. As soon as it is removed from the tube holder, when all the other tubes have been collected, or while the very next tube is being collected. Tube holder. As soon as it is removed from the tube holder. I think it's as soon as it is removed from the tube holder. Yes. Because you're supposed to take it out and then go like, you like tilt it back and forth below. And then you put it down and then connect and do the next one. An appendectomy is performed in a freestanding ambulatory surgical center and is an example of, I think, tertiary care. Secondary care. Okay. Involves care by specialists in a particular area of healthcare. An appendectomy performed in an ambulatory surgical center is an example of secondary care. Managed care is a system of healthcare delivery and financing that involves primary, secondary, and tertiary care. Primary care entails initial consultation and treatment by a family physician or other caregiver. Tertiary care implies highly complex or specialized services delivered primarily in inpatient facilities to patients who stay overnight. Okay, so I thought it was more complex. I thought an appendectomy was more complex than it actually was. That's where I went wrong. Which of the following is required by the bloodborne pathogens standard? Providing isolation of patients known to be HIV positive, gowning before entering rooms of AIDS patients, having warning labels on specimens from AIDS patients, or wearing gloves when performing phlebotomy. I think wearing gloves. Yes. 3 tubes of cerebrospinal fluid are collected during a patient's lumbar puncture. Which tests will most likely be performed on the 3rd tube? Shit. Glucose? Cell count and differential. I don't know the answer to that one, so I just guessed. The 3rd tube is used for cell count and differential because it is the least likely to be contaminated with blood cells introduced during the puncture. Okay. The 1st tube is used for chemistry and immunology tests. The 2nd tube is used for microbiology studies. If a 4th tube is collected, it is typically used for cytology or other special tests or as an extra tube. Okay. Which specimen can be centrifuged immediately upon arrival in specimen processing? Blood culture in an SPS tube, calcium in a green top tube, CBC in a lavender stopper tube, or creatinine in an SST tube. I think it's CBC because the other ones need to clot first. Calcium in a green top tube. Calcium in a green top tube can be centrifuged immediately upon arrival. Well, okay, thanks. Okay, it's not CBC, it's calcium in a green top tube. Green top tubes can be centrifuged immediately. Urine cytology studies look for the presence of cytology studies? Abnormal cells? Yeah. Urine cytology studies look for the presence of abnormal cells that have been shed from the urinary tract into the urine. Cytological analysis of urine can detect cancer, cytomegalovirus, and other viral and inflammatory diseases of the bladder and other structures of the urinary system. Okay. Interesting. A separator gel prevents glycolysis after the specimen has been centrifuged, as soon as the specimen is collected, in tubes used for serum samples only, or when the specimen is thoroughly mixed. I think when the specimen is thoroughly mixed. Oh, after it's been centrifuged. Prevents glycolysis. Damn, okay. Separator gel has a density between that of serum and plasma and cells. During centrifugation, it undergoes a change in viscosity and ends up between the liquid portion of the specimen and the cells, becoming a physical barrier between the serum or plasma and the cells, which prevents glycolysis. Oh, okay. So this actual separation of the cells and the plasma, the serum, is what prevents the glycolysis. Okay. Where's the best place to apply the tourniquet? 3 to 4 inches above the median puncture site, distal to the venipuncture site on the forearm, distal to the wrist bone if drawing a hand vein immediately above the venipuncture. I think it's 3 or 4 inches. To be eligible to make an autologous donation, a person must have a hemoglobin of at least 15 GDL. I don't know. What the heck kind of question is this? Sure. Damn it. To be eligible to make an autologous donation, a person must have a hemoglobin of at least 11 GDL. Okay, interesting. That's a fucked up question. The body organ targeted by HBV is the liver? Yeah, hepatitis means inflammation of the liver. Liver. The word hepat means liver, and the suffix itis means inflammation. Hepatitis B virus and other hepatitis viruses target the liver, causing liver inflammation. All of the following tests had been ordered on a patient in ICU. The nurse agrees to assist the phlebotomist in collecting the specimen. The phlebotomist says that before beginning the collection, a cup of crushed ice and water must be available to cool the volatile specimen. Which specimen will be placed in the ice? I want to say ammonia. Yeah. Specimens such as ammonia must be cooled by placing them in a crushed ice slurry, cooling block, or other suitable cooling device. Only the second vowel of the ending is pronounced in the word chordae dyspnea nuclei. Chordae, protozoa. I think it's chordae. Yeah. That was hard. I had to pronounce them all out loud. Which person would have responsibility for seeing that nurses maintain quality bedside testing? Manager of support services, supervisor chemistry, supervisor hematology, or supervisor point of care? I think supervisor point of care. Yes. The OCT. Specimen processor removes the stopper from a tube without barrier protection and feels a mist of specimen touch his eyes. What type of exposure occurs through eye contact? Permucosal. The most common reason for glucose monitoring through POCT is to check for sporadic glucose in the urine, diagnose glucose metabolism problems, monitor glucose level for diabetic care, or control medication-induced mood swings. I think it's this one. Yes. A patient complication associated with arterial puncture is hemolysis, numbness, phlebitis, or venostasis. Numbness? Yeah. Hemolysis, Phlebitis is inflammation of a vein, not a consideration in arterial puncture. Venostasis is defined as transferring of blood in an extremity by compression of the veins, and is usually the result of tying tourniquet too tight and leaving it in place for too long. Tourniquet is not used for arterial. Okay. Which of the following actions taken while filling microcollection tubes would be considered incorrect technique? Letting blood run down the tube's inside wall, scooping up blood as it runs down the finger, tapping the tube gently to settle the specimen, or touching the tube scoop to each blood drop. I think scooping up blood as it runs down the finger, because you're not really supposed to like scrape your finger, because it's gonna like feel like tissue. Scooping or scraping up blood that runs down the finger is not proper technique because it introduces contamination, activates platelets, and can cause hemolysis of the specimen. Correct technique includes touching the tube scoop to the drop of blood and letting the blood run down the inside of the tube. An occasional tap of the tube may be necessary to settle blood to the bottom of the tube. Jesus Christ. Which of the following are abbreviations for cardiac enzyme tests? This is a glucose tolerance test. I don't think it's that. I think this one's... I forgot what this one is. Damn it. Creatinine kinase, CK, and lactate dehydrogenase are enzymes present in cardiac muscle. They are released during myocardial infarction. Yeah, okay, I forgot that. This one and CK and LDH have to do with heart attack. Alkaline phosphatase and alanine aminotransferase, ALT, are enzymes measured most commonly to determine liver function. Blood urea nitrogen is a kidney function test, and prothrombin time, I didn't even realize that was prothrombin, is a coagulation test used to monitor anticoagulant therapy. A glucose tolerance test measures glucose metabolism and erythrocyte sediment rate. Erythrocyte sedimentation rate is a non-specific indicator of disease, especially inflammatory conditions such as arthritis. ESR is for arthritis. Okay. Probably did really bad this time. I wouldn't be surprised if I got like 60%. 70 again. Oh my god, we got 70 again. Jesus Christ. Jeez, dude. Ugh. How long has I been studying? About an hour. I think I can keep going. I think I'll do one more. Come on, we can do better. Okay. Which of the following is not a valid reason for failure to obtain a blood specimen? Not a valid reason. The patient adamantly refuses to have blood taken. The patient was unavailable at the designated time. You made an attempt but were unable to obtain the blood, or you did not have the right equipment in your tray. That's your fault. A phlebotomy needle that does not have a safety feature cannot be used for any venipuncture procedure, must be used with a holder that has a safety feature, requires immediate recapping after venipuncture, or should be removed from the holder. I think it's neither of these. I'm choosing between these two. It needs to be a holder that has a safety feature. I think this cannot be used for anything. I don't know. I've never seen something like this. Must be used with a holder that has a safety feature? I'm gonna guess this one. Ah, god, you, dude. Not you. Not you. Fuck me. She's too old to say this. Fuck. Okay. The bariatric tourniquet is used for not ABG collection. Bariatric. I think bariatric means obese. Bariatric means pertaining to the treatment of obesity. Yes, I got it right. I knew it. I was like, does a bariatric mean obese? Polite way to refer to individuals and items for individuals who are extremely overweight, whether or not they are actually being treated for obesity. And consequently, a bariatric tourniquet is an extra large size tourniquet designed for use on obese patients. A tourniquet is not used for arterial blood gas or any other. Okay, yeah, we know that. Which test specimen has to be collected in a metal-free plastic container? What? I don't know. Hello, Fubzilla. How are you? I'm just studying right now. I don't know. You can hang out. Wait, what? Okay, cool. I'm in just chatting. I was like, I thought I forgot to change the category. That would have been embarrassing. So I come in here thinking I'm playing a game. Not playing a game. I'm guessing between these two. I'm gonna guess indirect. Damn it, urine! I was like, it can't be urine because there's all these bilirubin ones. Not all good? Okay, cool. A urine sample for bismuth must be collected in a metal-free plastic container to avoid interfering substances from the container when tested. Which of the following actions violates a chemistry safety rule? Adding the acid to the water when diluting an acid. Making a 1 to 10 dilution of bleach to clean a counter. That's actually a good thing to do. That's like the right thing to do. Adding bleach to a cleanser to make it more effective, or all the choices. I think adding bleach to a cleanser to make it more effective. Yes. Ha ha ha. Bleach solutions should never be mixed with other cleaners because doing so can release dangerous gases. Yes. The term tort means a felony charge? I think criminal action. Wrongful act? Oh man, I forget. Okay, well then if, it doesn't matter. I'll know the answer once I click one. I think wrongful act. Yes, okay. Hell yeah. A tort is a wrongful act resulting in injury for which a civil rather than criminal action can be brought. A tort is committed against one's property, reputation, or other legally protected right for which an individual is entitled to damages awarded by the court. Damages are generally in the form of monetary awards. Which of the following specimens may require chain of custody documentation when it is collected? Drug screen. Which of the following is the best thing to do if your hands are visibly contaminated? Clean them with a hand sanitizer, clean them with clean gloves, wash them with soap and water, or wipe them with wash them with soap and water. Which blood cell increases during allergic reactions and pinworm infestation? Eosinophil? Oh shoot. Not neutral. Pinworm infestation. I'm guessing between these two. Basophil. Duh! Dude, I keep doing that. I keep guessing the wrong one. An eosinophilus is a type of granulocytic white blood cell that can ingest and detoxify foreign protein and help turn off immune reactions. Consequently, eosinophils increase in numbers during allergic reactions and infestations of parasites such as pinworms. Okay. Eosinophils, allergic reactions, and pinworms. Okay. The semilunar valves are located at the exits of both of the ventricles? Yes. Aha! Semilunar valves are located at the exits of both of the ventricles. Half moon. Each flap presents holes. Okay. During centrifuge operation, what describes how fast the rotor is spinning? RPM, rotations per minute. Yes. Which of the following tests is sometimes performed on amniotic fluid? Amniotic fluid. I'm really bad at these. Alkaline phosphatase, alpha fetoprotein, lactic dehydrogenase, or reticulocyte count. I'm leaning towards alkaline phosphatase. But I'm not sure. I'm just gonna guess. Damn it! Alpha fetoprotein. Alpha fetoprotein, AFP, is an antigen normally present in the human fetus. Antigen normally present in the human fetus. Also found in amniotic fluid and maternal serum. Abnormal AFP levels may indicate problems in fetal development, such as neural tube tests. AFP testing is initially performed on maternal serum, and abnormal tests are confirmed by AFP testing and on. Amniotic fluid is the fluid inside the fucking. Okay. It's the fluid inside the womb. I keep forgetting that. An example of employee screening for infection control is requiring employees to have infection control. B vaccinations? It's either that or TB testing. I fucking... Bitch, I told you. I keep doing it. Purified protein derivative is the antigen used in tuberculosis test. In a tuberculosis test. Both PPD and TB are abbreviations used for the test, which screens for exposure to tuberculosis. Hepatitis B vaccination, measles vaccinations, and tetanus booster shots are examples of employee immunizations that prevent the spread of infection. Employee screening! Oh my god. I have to read better. I'm just bad at reading. Which of the following capillary puncture techniques is incorrect? Discard equipment packaging in the regular trash. Position the site downward to promote blood flow. Press the lancet down into the skin so that it does not slip. Tap microtubes gently to settle blood to the bottom. And between discard equipment packaging in the regular trash and press the lancet down into the skin so it does not slip. Yes, okay. Use only enough pressure to keep the lancet firmly against the skin. Pressing down hard on the lancet compresses the skin and can result in a deeper puncture than intended. A capillary puncture should be done rather than a venipuncture when in all the following situations except when the child is less than 1 year old, the light blue top tube is needed, the patient has difficult blains, the chest... Blains? Why did I say blains? Veins. Or the test uses very little blood. I think a light blue top is needed too, because a light blue top tube needs a certain amount of blood in order to work correctly, because it like needs to have a certain ratio to the additive. Yeah, blood cultures cannot be collected by capillary puncture because of the volume of blood required for testing and contamination issues. The light blue top tube cannot be collected by capillary puncture because coagulation tests are greatly affected by tissue thromboplastin. Okay, so that's why. A patient is prescribed a list of laboratory tests, however, only select ones are to be drawn before surgery. Which abbreviation is used for these tests? Pre-op. PO means by mouth, prep means preparation, or PRO means prothrombin time. Not really. His personal zone of comfort is a radius of, I think 1.5 to 4 feet. On a blood smear made using right stain, the granules of eosinophils stain this color. Lavender? Granules? Orange red. Oh, okay. Eosinophil is a type of white blood cell called a granulocyte because it has granules that are easily visible when viewed on a blood slide stained with a special stain called a right stain. Eosinophil granules are large and bead-like and stain bright orange-pink. Excuse me. I thought it was lavender because the stain that I use at work makes everything lavender. Okay. Bright stain or red. Which of the below is how quality control is thought of as a tool? Aims to prevent errors by being proactive, aims to identify and correct errors by being reactive, as managerial for laboratory supervisors, as corrective for laboratory personnel. Tool? Which of the below is how quality control is thought of as a tool? Aims to prevent errors by being proactive? I don't know. Corrective. I don't like this question. It's worded weird. Aims to prevent errors by being proactive is an objective for quality assurance. Aims to identify and correct errors by being reactive is an objective for quality control. What? Okay. As a managerial tool for laboratory supervisors is a tool for quality assurance. As a corrective tool for laboratory personnel is a quality control as a tool. Is quality control as a tool. That's so dumb. Dude, what the fuck? What kind of question is this? I don't like this question. I hope I don't get this question on the test. But okay. As corrective for laboratory personnel is a tool. A patient is to have a stool specimen collected PC. When should this specimen be collected? I think after meals? Yes, PC means after meals. I knew it. Below normal blood pH is referred to as acidosis? Yes. Low pH is acidic. High pH is alkaline. Which area remained the same when the Needle Stick Safety and Prevention Act revised the bloodborne pathogen standard? Availability of vaccination against HPV for all employees, modification of definitions relating to engineering controls, new requirements for record keeping for all needle sticks, or obtaining employee input in selecting engineering controls. I think modification of definitions are probably the same. Damn it, availability of vaccination. Really? Let's stay the same. Interesting. The Needle Stick Safety and Prevention Act imposed additional requirements on healthcare employers concerning SHARP's procedures in order to further reduce healthcare worker exposure to bloodborne pathogens. The Act directed OSHA to revise the BBP standard in the following 4 key areas: revision of updating the exposure control plan, solicitation of employee input in selecting engineering and practice controls, modification of definitions relating to engineering controls, and new record-keeping requirements, including the requirement to keep a SHARP's injury log. No change was made to the HPV vaccination process. That's lame. I don't like that. What is the best way to prevent reflux of tube contents during a blood draw? Allow the tubes to fill from the bottom up. Collect tubes in the proper order of draw. Keep the tourniquet on until the last tube, or mix the tubes as they fill while they fill with blood. I think allow the tubes to fill from the bottom up. Yeah. Reflux is the term used to describe the backflow of blood from a collecting tube into a patient's vein during a vein puncture. Reflux can happen if there is pressure change in the vein that occurs normally, or when the tourniquet is released. It can only occur if blood in the tube is in contact with a needle during vein puncture. Reflux of blood mixed with an additive such as EDTA can cause an adverse patient reaction. Keeping the arm in a downward position so that the tubes fill from the bottom up and avoiding back and forth movement of tube contents during blood collection will prevent blood in the tube from being in contact with the tube holder end of the needle and will therefore prevent reflux. One complete contraction and subsequent relaxation of the heart is called one cardiac cycle. If the following specimens were all requested for collection at the same time from different patients, which one would have the highest priority? Stat lights in the ER, 2-hour PP glucose, ASAP glucose in the ICU, or timed blood cultures? I think stat lights in the ER. Heparin is used in ABG specimen collection to increase the flow of blood, prevent clotting of the specimen, reduce the amount of pain, or stabilize oxygen and CO2. I think it prevents clotting of the specimen. Yeah. A nurse hands the phlebotomist a bloody fluid specimen, take back to the laboratory. The nurse indicates that it is collected from the lung cavity. What is the medical term for this type of fluid? Pleural fluid. Yes. Which department is responsible for administering a patient's oxygen therapy? Respiratory therapy. Not physical therapy. Application software called middleware. What the heck? Accepts data download from POC instruments. Controls user requested computer operation. Is considered temporary or secondary storage. Is the computer equipment used to process data? I don't know what middleware is. I never learned. I don't know what it's talking about. I'm gonna say, I'm guessing it's between considered temporary or secondary storage and accepts data download from POC instrument. I'm gonna say this. Yeah, yes. I love when I guess correctly. It makes me feel good. Application software called middleware accepts data downloaded from POC instruments. Middleware is sometimes called plumbing because it connects two sides of an application and passes data between them. Oh, that's cool. There's like little pipes. Cute. What is the purpose of an anti-glycolytic agent? Anti-glycolytic agent enhances the clotting process, inhibits electrolyte breakdown, it preserves glucose, or prevents clotting. I want to say it preserves glucose just because it says glyco in it. But the anti part is throwing me off. Maybe it enhances the clotting process? I don't know. Damn it! I should have just went with the fucking glucose thing. Go with your gut. God damn it. Go with your gut. Go with your gut. A substance that inhibits or prevents glycolysis, metabolism of glucose by the cell. Okay. Glycolysis gets rid of glucose. Okay. So anti-glycolytic will save the glucose. The most common glycolytic inhibitors are sodium fluoride and lithium iodoacetate. The heart's pacemaker is the sinoatrial node, I think. Yes, sinoatrial node. I remember it was called something node. SA node. Upper wall in the right atrium. Okay. These are the initials of the federal agency that instituted and enforces regulations requiring the labeling of hazardous materials. OSHA? Yes. HAZCOM standard. Federal law. Okay. What is the best way to extinguish a flammable liquid fire? Not that. Whether it was a special fire blanket, spray it with Class A extinguisher, spray it with Class B extinguisher. Yes. Class B is flammable liquids. Okay, Class A is ordinary fires. Class B is flammable liquids. Class C is electrical fires. Class D is combustible metals. And Class K is cooking oils and kitchen fires. Boom. That's all you need to know. What appears as a large bulging vein in the forearm above the wrist? An AV fistula? An AV fistula appears as a large bulging vein in the forearm above the wrist. That's kind of weird. Which phrase describes class C fires? I just said this. Involve electrical equipment. Yes. Hello, chef. Hello, XLR. I'm studying. A specimen is being collected for an O and P. Ova and parasites. If a specimen has inadequate identification, the specimen processor may add the missing information to the label. Class C for electricity, that makes sense. Yeah, so, because they both start with the same letter. No. Okay, so the class A is ordinary fires, like ordinary fires. Class B is flammable liquids, like flammable liquids. Class C is electrical fires. Class D is combustible metals. It doesn't have a D in it, but it kind of sounds the same. And then Class K is cooking oils and kitchen fires. K for kitchen. Boom. That's how we're supposed to remember it. And honestly, it kind of works. If a specimen has inadequate identification, the specimen processor may add the missing information to the label, ask the phlebotomist to get a new sample, contact the patient for correct information, or refer the tube to the laboratory supervisor. It's almost never, the answer is almost never the supervisor. I think ask the phlebotomist to get a new sample. Because this sample is no good. It doesn't have proper identification. During an Allen test, where are the results recorded? Oh, I don't know. In the computer system? I know what an Allen test is, but I just don't know this question. Why is it not class M for metal, class E for electric? Like, they could have just made it easy. I don't know. Because they were like, oh, A, B, C, D, K. And then the K, actually K is like more recently added to it, so I don't know why they didn't make it E. I guess they thought that would be confusing. Comsci does shit like that all the time. Yeah, I don't know. Where are the results recorded on patient's training? On the requisition. Oh, okay, that makes sense. During an Allen test, results are recorded on the requisition. Okay, makes sense. This test detects parasites and their eggs in feces. O and P. We just had a question similar to that. Wearing gloves during phlebotomy procedures is mandated by OSHA. Which medical specialty treats patients that have tumors? I want to say oncology, but I can't remember which one means tumor. Ophthalmology? I think oncology. We just decided it makes more sense to not do a bunch of nonsense. I don't know. I'm gonna guess this one. Yes! Okay, onco means tumor, and the suffix ology means to study of. The term oncology is used to describe the medical specialty. It treats patients who have tumors. Geriatrics is a branch of medicine that deals with problems of aging. Ophthalmology deals with eye disorders. Ophtha means eye. Orthopedics deals with musculoskeletal or system disorders. What does the NFPA code word RACE mean? I think it's rescue, alarm, confine, extinguish. This is like, has to do with fire stuff, fire safety. A test that identifies bacteria and the antibiotics that can be used against them is the CNS test? Yes. Culture and susceptibility. Culture and sensitivity. That's my bad. Identify the condition in which a unit of blood is withdrawn from a patient as a treatment. Autologous donation? Hemochromatosis. Hemochromatosis is a disease characterized by excess iron deposits in the tissues. I've never heard of hemochromatosis. I was thinking, that's not like it. That, I guess autologous donation is not a treatment for anything. It's like, you would do it, you would like... you would give your own blood in order, like a week or so before surgery, in order to use your own blood again during the surgery, like so they don't have to donate from someone else, and it eliminates a lot of like risks and stuff like that. But hemochromatosis is a disease characterized by excess iron deposits in the tissues. Okay. Which situation is a sentinel event? Shit. I don't know. Patient's medication dose was 10 minutes late. Patient received another patient's breakfast tray. Patient developed a rash after receiving a medication, or patient has the wrong eye surgery. Had the wrong eye surgery for cataract. I think this one. Yes. A sentinel event is any unfavorable event that is unexpected and results in death or serious physical or psychological injury. Having surgery in the wrong eye is a sentinel event. A late medication dose, receiving the wrong breakfast tray, and developing a rash after receiving medication was not result in death or serious physical or psychological injury. Okay. Which of the following is normally a proper site for finger puncture on an adult? Distal segment of middle finger. I think this one. End segment of either of the thumbs. Never use the thumbs, they have a pulse. Medial segment of the index finger. You would not use the medial segment. Or proximal phalanx. Ring finger. Proximal. I think that's like the... This is medial, this is distal. This is medial, proximal. Medial. You would use the distal segment of the middle finger. Which body plane divides the body into equal portions, mid-sagittal? Which of the following tests is collected from patients with FUO to rule out septicemia? Blood cultures times 2. Blood cultures for septicemia. Remember that. The plantar surface of the foot is the sole or bottom. This is also the plantar surface of your hand. This is the dorsal surface of your hand. Proper specimen handling immediately following collection involves. Proper specimen handling immediately following collection involves mixing the specimen to prevent clotting, placing the specimen in a green top tube, removing only air bubbles from it, or using the safe needles to tap the syringe. That doesn't really have to do with specimen handling. I think mixing the specimen to prevent clotting. Yes. Submit your test. Okay, let's see how we did. I did really bad in the beginning. This one. We did 50 questions. 78! Oh, we did pretty okay this time. I mean, my standards are so low now. Oh my god. I'm exhausted. I think it's pretty good. Oh, my stomach is growling. Not good. I don't know what to eat. I have cereal. I have mac and cheese. I have ramen. Because I do have food. I just don't have much food. I have eggs, but I don't really want to cook that right now. Eat better? Bitch, I would if I could. If I were rich, I would eat so good. You know what? Like, this morning and last night, the light for my, like, my wall neighbor, that's been empty. That unit has been empty for, like, the past 3 months or something. Wish I would if I could. Toxic. What are you talking about? But anyway, so the unit next to me has been empty for the past 3 months, and for some reason this morning and last night the light was on, so I was like, ooh, I can like see in there. I can see what it looks like. So I took a picture. I took 2 pictures. Let me show you. I'm like kind of interested in it. Depending on how much it costs. They have a fucking oven. This is from the window. And then they have a fridge on the other side. And then a bathroom, and it has, I don't know if you can see, but it has 2 bedrooms. There's 2 doors right there. Do you see them? 2 bedrooms. Dude, what if I can afford it? What if you get a homeless small room? I know, and I get this one. Yeah. Well, I didn't know about that. Like, there was no, I never found a listing for that. I don't know how, like, where it was listed. But, yeah, I'm kind of, like, curious as to how much he's renting it out for. And I'm also curious as to why it's been empty for so long. Are they not trying to rent it out? What are they trying to do? I want it. Can I have it? I can have a room for my, like, hobbies and shit, and a room for my bed. And then a living room. Real, I want it. Maybe I can get a roommate, too. Or, like, so they can have the other room. And I can just have my room. And then I can keep because I have an extra bed frame in my car. I don't have to use this one. This one can be used as a couch. I can just get like a new futon mattress for this one and then use my mattress for myself. And then put it on the extra bed frame that I have. And then have a bed and then also a futon couch thing that can turn into a bed if I have guests. And then I can have my TV in the living room. And, dude, I want a place with like a bedroom so bad. You can have a whole bedroom. You have a whole bed frame in your car? Yeah, in the trunk. It's like metal and not assembled. So it's like still in the original box. I haven't even opened it. So it's just sitting in my car. Rotting away. I feel like I should eat something, but I'm too lazy. I do have these chips right here, but it's only a little bit of chips. It's like small. Should eat something. I probably should. I also have this tea, sweet tea from McDonald's that's like watered down because all the ice melted. I have half of a Gatorade bottle. And I have food. What else do I have? Not much. Not much food. I have like ramen, mac and cheese, cereal. Those are my options. I ran out of taquitos. I could also just make a protein shake, but I already have 2 drinks here, so I don't think I should make a drink. I mean, a protein shake would be more filling than these drinks, but like, I feel like I shouldn't make. I also have, I don't want to cook right now because I want to stream, so I want it to be quick. Maybe I should just make mac and cheese again. But I've been eating that a lot recently. I don't know. I just want this week to be over. I'm tired. I just want my day off. I'm so exhausted. I was so fucking exhausted. You know what? I'm gonna make mac and cheese because it's easy and I'm tired. I'll be right back. cleaning my feetsies. My floor has hair all over it. I don't want to hair all over my feet while I sit on my chair. You know what I'm saying? I keep studying. I don't know. I feel like I should take a break. I've been studying for like an hour and a half. Almost. Ew, chef feet. Ew, gross, nasty. Calm down. Okay. Oof. Did you see my alien antenna that I got? Pretty silly. Wanna see them? I'm so excited to wear these. I think it's gonna look great. They're so cute. I'm glad I didn't get the light up ones, because the light up ones had this like weird thick part on the headband, and that would have looked. I'm glad I didn't get them. I'm like probing the air. Looking for fucks to give. I'm just kidding. Hey, yo. Hello, I'm back. Hello. I'm showing off. What the fuck is this? I'm showing off my antenna. Of course. What else? Why is only one of them moving a lot? Yeah. Chef is chefing? Yeah. Let her cook. I'm just showing off your antenna? Yeah. What else would I mean? We're not on Twitch? Holy fuck, man. What else would I mean? You're freaking gross. Cute. Goodness. I also got. I already wrapped this one, but I haven't decided how I'm gonna wrap this one. This is the bracelet. I'm hoping it's big enough for him. I think it will be. You're the one showing it off during a live stream. Not my fault. Oh my goodness. Calm down. But it actually has like a magnet in like the way that it hooks in. That's cool. But yeah, so that's that one. And then speaking of calm down, excuse me. And then this one has the black chain, but I've already wrapped it. Not that interesting. It's late in time. What the heck does that have to do with calm? Explain. Please explain. Yo, I'm so fucking like impatient. I want this to be over with. I want to take the test so that I can do all the fun stuff that I have planned. It is a calm game. Sometimes it makes me want to die. Okay, one second. Let me grab my mac and cheese. It's my last mac and cheese, by the way. Add. I said sad, not bad. Oh, but actually there's a vampire that's kind of scary. Yeah, it's a scary game. It's a horror game, actually. Maybe I'm a little too scared to play it. I do want to do one more set of questions before stopping. So we'll do 50 more questions and then we'll play a game. Actually, it's already 8:30. I still game like RE4. No. No. This looks weird because you can't see what I'm doing with my hand. I'm just mixing my Mac. Don't worry about it. Audio nerds, what is Monk Low? Please listen to the following audio file. I'm a little scared. Let me finish mix and match. That's good enough. I'm scared. Hold on. I don't want it to be interrupted by the lo-fi. I mix my Mac on the daily. That's me. I'm this. Interesting. Thank you for sharing. That was so relatable. Honestly, listen to it again. No. Why listen to it again? You know what it reminds me of? It reminds me of Buddhist chanting. What? No, I'm not gonna listen to it again. It reminds me of Buddhist chanting. You know, let's see if we can. For an hour? Goddamn. Okay. I'm gonna see if this sounds the same. Not that one. It's a very specific vibe, okay? Everyone else is, you're like, okay, haha, I guess I'll do that thing I don't want to do. And you're like, fuck this guy. You're easier to say no. Samputo Bhagava Uttam Abhivantang Abhivatemi. I have these memorized. This isn't Monk Low MP3. Dude, these prayers are ingrained in my brain. When I tell you that I was raised half Christian, half Buddhist, I was not lying. Tassa bhagavato arahato samma sambuddhassa. Namo tassa. You say this one 3 times. Arahato samma sambuddhassa. I'm like remembering all the years of me going to this temple and like saying these fucking chants. One of the monks, you know what this reminds me of? What? Monk Low MP3? The Buddhist chants? Oh, I remember this one. I never memorized this part, but I remember how long it fucking felt. You know what? I'm sharing this with my sisters. They need to remember this as well. Why do I keep my watch on? Take it off. No distraction. Only chant. Okay, let's go to a different part. Not feeling this part. I like the beginning. The beginning was the parts that I remembered really well. Okay, shut up. I'm tired of it now. I just want them to watch the first part. I'll let you know if they say anything. I don't even know if they're gonna watch it. Let me see. Hey Google, what time is it in Bordeaux, France?
The time in Bordeaux, France, is 5:30 a.m. on Saturday.
God damn it. My sister's not gonna watch it right now. I mean, no disrespect to the Buddhist chants. What? What are you gonna say? You're gonna talk shit? I can't believe you. That's disrespectful. But my Gregorian chants got them beat. What Gregorian chants are you fucking talking about? I doubt they're better. I doubt it. One of the monks was like a white guy, and so he was fluent in English and in Thai. And so whenever he would lead the chants, he would have us also read the English translations of the chant. So we would read one line of the chant, and then we would read the English of it. So it would take like twice as long to get through the morning chants. And I fucking hated it. I was like, I really liked him. He was Prat Mike. Prat means monk in Thai. So he's Prat Mike. I loved him. But like I hated the fact that he would do that. I hated it. I was like, this is gonna take fucking forever. And it did. It took forever. But you know what? It did make us appreciate it more because we actually knew what we were saying. We were like paying more attention to it. Are these Gregorian? These better be Gregorian chants, or else I'm not watching it. At 432 hertz, 3 hours of healing music. Perfect. My chakras will be aligned by the resonance. Honestly, that is a redeeming quality. My DNA will be repaired. It's actually just radiation. Okay, it's pretty cool. I'll give you that. Gregorian chants. I'll give you that. But I'm not gonna watch it forever. My little sister better fucking read this. She isn't just in LA. She has no. You can also listen to Enigma Sadness. Cool version. Although that is copyrighted. Oh no! So you're gonna listen to it in a small amount. Yeah, I think I've heard that before. Good one. That's a good one. What a banger, though. I know, right? I just saw something. You don't need to worry about it. You guys have ruined my recommended. Ruined it. all of the stupid videos you guys put in make me watch. They're not stupid, but like they really do make my recommended fucking crazy. Recognize my face. I don't need either of those notifications. Get them out of my sight. Wow, calling it stupid? Okay. Improved it. Excuse me. Oh, it improved my recommended? Maybe. Honestly, maybe. Not G's. Oh my god, no. No, I'm not watching it again. So, I'll go to like this part of it. Broken hearted, ooh, since the day we parted. Why did I ever let you go? Your internet died just as you realized the joke. That's kind of funny.
I've been angry and sad about the things that you do.
I can't even be mad because it's such a good song.
I made up my mind to tell you that we're through. But when you go, when you slam the door, I think you know that I won't be away too long. You know I'm not that strong.
Just one look and I can hear a bell ring. I can't even sing that low.
And I forget everything. Whoa, whoa, Mamma Mia, here I go again.
I'm vibing with my Mac. This is such a good night. This is peak existence right here. Listening to ABBA as sung by man who flew to Japan to sing in a river. Eating mac in bowl, plastic bowl. Big cold river. My bad. Need to say it? I just said big river. It is cold, yes. Broken hearted, ooh, since the day we parted. Mama, did I ever let you go? Mamma Mia, really know.
I could never let you go.
Why should I ever need to practice dancing when I already have the best dance? Way back and forth. That's the only dance move I know. And I refuse to learn any other dance. I actually learned a K-pop dance because my friend invited me to go with her to her K-pop dance club. And so I was like, cool. And I learned the dance, and then they had to close the club after me only going there once because of COVID. So I only got to go to one club meeting. But I only learned the chorus of one song. You wanna know what song it was? I have to remember what it was called. Twice. Oh, it was this one. I can't play the whole thing. I texted a cute girl recently about Gru's first name. How did that go? Okay, the chorus is coming. I can't remember the whole thing. I can't remember the whole thing. Drew's first name is Polonius. Okay. Did I tell you about this? Yeah, I think you did tell me, but I forgot what it was. Okay, that's it. I don't want to get copyrighted. Or else this whole interesting conversation will get muted. That'd be so lame. What should we listen to? We'll just do this one for now. Ah. Just remembered Beat Saber. Made me sad. Imagine having a place where I can play Beat Saber. That'd be crazy. Found this banger recently. Data and Picard. Pogo presents.
You know, back when I was in the academy, we would follow every toast with a song.
What the fuck? Not California. I mean, you're right, but also I don't want to leave California right now. I have reason to stay. My parents want me to move to Las Vegas with them because they already live in Las Vegas. And I'm just like... Also, my phlebotomy certification is only valid in California. Dude, he's cooking and booking right now. Zoo-wee mama. He is. Why does he have yellow eyes? Oh, now he doesn't. Why is he wearing like pale makeup? I have so many questions because he's Data. Oh, I see. Of course, how can I not have known? It's Star Trek? I don't know anything about Star Trek, actually. Or Star Wars. So, I'm sorry. I apologize. I've never been into either of them, and I don't really plan on getting into it. I don't either. I mean, I don't know the basics or whatever, but this song is a banger. That's all I know. I guess you're right. That's all you need to know, honestly. I'm intrigued by this. I'm not enamored. I'm like, what's the word? How familiar are you with the 1988 National Aerobics Championship? Is that the aerobics thing you were talking about last time? Is that the same thing? It makes him look like a lizard. The eyes and the makeup. Especially the fact that it's on his lip. The foundation.
That's an interesting twist.
Oh, it's like an actual character. I see. I don't know, Chef, I forget who I've forced to watch the memes and such. Let me see. Have you heard of this one? I just saw it in my recommend. You should actually remember what I've told you, that way I don't need to. Bitch. I just don't remember if it was a championship.
You're walking in the woods. There's no one around and your phone is dead. Out of the corner of your eye, you spot him.
Shia LaBeouf.
He's following you,
about 30 feet back. there's the words here. Oh, you're a humor song enjoyer? Yeah, I guess.
You're looking for your car, but you're all turned around. He's almost
Almost upon you now, and you can see
there's blood on his face. My
God, there's blood everywhere. From Shia LaBeouf. Shia LaBeouf. Shia LaBeouf. Shia LaBeouf. Shia LaBeouf. I love this song.
Now it's dark, and you seem to have lost him.
It's a good one.
Hopelessly lost
If this
yourself.
part gets muted for some reason, I'm just like, if anyone watches it, they're just gonna see me dancing in silence. I don't love the song. Why not?
A small cottage
What's
with
wrong?
a light on. Hope. You move stealthily
It's
toward
good?
it, but your leg.
It's a good song.
It's caught in a bear trap.
Ah, it's caught in a bear trap. This is my favorite humor song. For a while, it was my favorite. I don't know what my favorite is right now. Shia LaBeouf. Winter. Find him. They look so like serious about it. It's great. What is your favorite humor song? Have you already showed me? Is it the ABBA one?
You've beaten Shia LaBeouf.
Isn't that Shia surprise? Shia surprise. Body slam it. Up. Normal Tuesday night. I've always had a humor. Is it serious? Well, okay. What's your favorite then? God damn it. You touch him in the neck. Take a potato Shia LaBeouf.
His head topples to the floor, expressionless. You fall to your knees and catch your breath.
Tricky
You're
question.
finally safe.
There are so many good ones. Well, show me one of your favorites. It doesn't matter if it is your favorite. It has fucking Shia LaBeouf. The only one in the audience. Ah. Okay. This was a recent one? Okay, let's listen. My mouth dreams. Neil Cicierega. No way. You don't know Neil? I don't know who Neil is. What a...
Bells. When the moon hits your big pizza pie like your eye, that's amore.
What?
When you've had too much wine, that's amore.
True.
Bells.
Interesting.
That's amore.
I'm reading the comments. Can't believe you don't know Neil. Who is Neil? Is it just the singer? Or is it the one who edited this? I don't know. Dude, my leg is fucked. My left leg on the medial side. I had my moped fall on top of it. Like the whole weight of it on top of my leg. Like 7 years ago. You know Neil's creations, I'm sure, but you don't know him. Yeah, I don't really pay attention to names and stuff. I'm really bad at names. This is also getting really weird, by the way. You've had too much wine. Calm down. Stop drinking. I'm taking the bottle. You need to stop. But anyway, so like my moped fell on my leg, and my leg got all bruised and swollen because of it. And I think I bruised my bone because it still hurts. You ever hear Potter Puppet? Yeah. Yes. That's funny. The Potter puppet. The ultimate showdown of ultimate destiny. I don't know that one. Or Bustin'? I don't know that one. Maybe I do, I just don't know the name. But I don't recognize it. Well, I'm really surprised. I also don't like explore the internet too much. Anyway, Neil made all of those and more. Interesting. Okay. Pew 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 pew. Scrolling up. Let's listen to Legend of Zelda music, I guess. It's not an explore, it's the top layer. Well, I guess I don't even explore the top layer. So what's next for the stream? We have about an hour left. I don't really know. Layton? Do I want to play Layton? Dude, I don't know, man. I don't want to say what I was gonna say. I just want to work in the lab. That's all I want. Lab, but I have to go through more schooling and I have to be a phlebotomist. Z the B!
Sheffy 3 cheer, Sheffy 3 cheer, Sheffy 3 cheer.
Thank you, Z the B! Thank you, thank you, thank you. Thank you. I work in the lab, there's a girl there. Must be nice. I told her that Gru's first name is Polonius! Okay, how'd that go? I feel like there's like something stuck in my teeth over here. In the back of my mouth. It's bothering me. It's been a long time. Hope everything's good for you. I know it has been a long time. Welcome back. And yes, things have been pretty good. Relatively good. Did you know that makes his brother Drew Grew? Drew Grew. What if... never mind. Forget I said anything. Okay, cool. Yes, good. But I have been studying. I just spent the first almost 2 hours of stream studying for my phlebotomy certification test. And I'm going to be studying about 2 hours every day for the next week up until Wednesday. In preparation for the test. Never mind, forget I said anything. Bitch, why you don't have to repeat it? That's what I said, and I said what I said. I gotta need a wife. New job, a wife, and a dog. So I don't have time for fun time watching Chef struggling on Zelda games. Sad. I'm happy for your new stuff in your life. That's good. But also, yes, I'm sad I haven't seen you here in a while. Sad. But recently we've been struggling with Layton games and Hogwarts Legacy and Tears of the Kingdom and Persona 4. Like, just a bunch of games. A new wife! Not just a job. Oh, okay. The wife isn't new. Okay, because I was like, He got a new wife for his job is new. Damn, I didn't know it had been that long. I know, right? I was like, damn, he did a lot. If you got a new wife and a new job and a new dog. Lots of new things, but just the jobs. Dude, the freaking group chat's going off again. I just don't like my phone buzzing a bunch of times. Steph, you're so funny. What the fuck? I just don't want my phone to buzz a whole bunch of times because it drains the battery. Kind of annoying. 26 notifications so far. It's the funniest thing. Just put on do not disturb, lol. But like, okay, maybe I'll just mute that conversation, but I'm not gonna put my whole phone. Because what if I get something important? Like my mom is. She thinks I'm dead if I don't pick up the phone. So I have to pick up the phone. She thinks I like killed myself or something if I don't pick up the phone. So I can't leave her hanging. Imagine being that popular. They're not talking to me. They're talking to themselves. They're talking amongst themselves. They don't care about me. I never talk in there. I don't even know why I'm still in that group chat. Do you have the same mom? I know, like, well, she has good reason to think that. I won't go into detail, but she has good reason to think that. So I just like have to pick up the phone. Unless I'm at work, then I just like text her like, oh, I'm at work. And then but I have to text her, or else she thinks I'm dead. Or she like checks my location because she can see my location. And so I think she knows not to. My ex hopes I'm dead if I don't pick up the bitch. What the heck? No. But maybe I will mute the it looks like they kind of stopped talking. It's mostly like pretty damn high right now. No. It's just like the siblings talking to each other because there's like a group of siblings in the group chat. It's just them talking. They're just talking to each other. I don't think I need to be part of that conversation. We don't hate siblings. I love my siblings. My siblings are great. But they better freaking read my message. They better see it. Check it. Stupids. Ew, family. Parts of my family, I'm like, ew. But like my siblings, they're cool. I like my siblings. But we hate when the siblings talk in each other in other people's chats. You mean like siblings, but siblings that aren't mine. They have to be my siblings, or else they're not cool. They're not even like all siblings. I think like some of them are cousins or something. I don't really know all of their relations. I don't pay attention to that. I think they told me like once and I forgot. Actually, one of them, they didn't even tell me. No one told me who she was. She just like showed up and started going to the events and stuff. And I like inferred that she was their sibling. I don't know. No one tells me anything. Cause like, I'm really like quiet and I don't talk very much. So like, I'm not like active in the group chat or anything like that. I'll normally like read everything most of the time, unless it's like really long. I have to read it. But then like, whenever there's like something new happening, I almost never know about it. I don't know how. I think I'm not cool enough to be in the mini group chats that they make. I'm not cool. Y'all think I have lots of friends, but like they don't really include me in everything. I'm just kind of there. I'm just like an extra that like appears whenever I'm given enough. Whoa!
Buy yourself a nice little gift for Christmas, smiley face.
Anonymous? Who did that? Thank you. What the heck? Who did that? Thank you for that. I don't. And Merry Christmas to you too. I don't think you have lots of friends. Don't worry. Hey, bitch, y'all. Shut the fuck up. But no, you guys like think I'm super social, but I'm not. Probably a sibling. Could be. Just kidding. They don't really. My older sister sometimes will like pop into my stream, and she's spoken in my stream like once or twice. But I don't think my little sister ever does, or my youngest sister. I don't think either of them ever watch my stream. But I'm not mad about it. They don't need to be here. No, I don't think you're super social. Do you do a lot of social events though? Okay, cool. So you understand. Good. Yeah, I just appear there. I am not being social. This is why I still have social anxiety. I don't know how to like get rid of the social anxiety. Like, I know it's like, oh, step out of your comfort zone, blah 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 blah. Like, how do you? I don't. Excuse me. And don't mention the fucking like Wi-Fi thing, because that's different. I'm talking about like being comfortable going to social events. LOL. What? Because you were gonna mention it? Fuck you. Gotta take my meds. I might as well take it now while I have this. I'm still wondering what game we're gonna play. It's 9 o'clock, so we still have an hour. Let me take my meds and I'll think about it. We have an hour. We had an hour 5 minutes ago too. Well, now we actually have like exactly an hour because it's 9 o'clock exactly. Earlier I had an hour and 10 minutes. So I just rounded to an hour because I'm silly. My wife had a Christmas party and just a fucking big one. My social anxiety, I'm gonna sweat so hard. Oh no. Yeah, when it's like your partner's family, that's scary. My partner's family, I mean, no, I don't have a partner, but like when I was with my ex, his family mostly just speaks Chinese, so that was really nerve-wracking to be around them because like, and like his neighbor is Chinese also, and she came over once and like said stuff in Chinese about like the jacket that I made, and she was like praising it, but I don't know exactly what she just speak Chinese back. I don't know enough Chinese. I can kind of recognize what they're saying sometimes, but like I can't, I'm not confident enough to like respond back. I could just be like yes or no. You know plenty, it's fine. Just say shit no matter what. And then like nod. I'm always too scared to speak Chinese. I'm not Chinese. Like, does that make sense? I'm not... But I did, the only time I actually used my Chinese, like, you can just speak it, no big deal. My wife is Chinese too, but I didn't meet that part of the family. Okay, I take note. Just speak it, no big deal. I know Chinese people who speak less Chinese than you. But still. This one time while I worked at Target, that was my like one of my first jobs. No, it was like my second job. But while I worked at Target, there was this like pair of women who came in who only spoke Chinese, and they were looking for these like those like, you know, those like straw wafers, like they're shaped like a straw, but they have like chocolate on the inside. They were looking for those, and we didn't have them at Target, but I looked it up, and they had a picture of what they wanted. That's the only reason I knew what they were saying, what they were trying to do. And so I was able to tell them, like, And then I like pointed to the Costco that was nearby, and then like Pocky, not Pocky, it's chocolate on the inside, not the outside. And like it looks like the straw has like a swirl on it. I don't know how to explain. Hold on. Ah. Hold on. I need to move stuff. Ah! Spirulines. Spirulines. I mean, I found it so fast. These things. They were looking for these. Pepperidge Farm, let's see if this... Yeah, basically the same thing. Oh, but I found it faster. Shut up! I type slow, okay? I'm a really slow typer. Yeah, same thing. Oh, they do have it at Target. Well, they didn't have it when I was looking for it. The French thing? French. My sister speaks fluent French. And she speaks a little bit of German, a little bit of Thai, a little bit of Chinese, a bit of Russian. I think that's it. I am French? Nice! You can talk to my sister. I mean, French. Smiley face. You change your mind? Yeah, I don't want to be small like this. I have to be big. You know what? Boom. Whoa! Holy fuck! Come on! Big chef. I forgot that I added that. I did it like over a year ago. It would have been even funnier if you had an even bigger scene. You should do. I have to do it even bigger. Make it 50 zooms. Boom! It'll shows like this much of my face. That'd be fun. But I wouldn't be able to move very much. I feel like. You know what I'm saying? Because or else I would leave the frame. Should we play? I'm leaning towards Layton, just because Hogwarts Legacy gave me a stomachache yesterday. I was like ocean sick. We're all leaning towards Layton. No, I don't want to. I'm just kidding. So you can get decent done. Also, you can decent done in an hour. I'm like Hogwart. One wart. One Hogwart. That's nasty. Fine. One second, I'm setting it up. Mario. Never mind, wrong game. Close enough, close enough. Okay, we got this, guys. We are smart, we are capable, we are geniuses. Okay, we get them first try within 30 seconds. Ready? After a long search, Luke and the professor finally reassemble the entire photograph. Oh yeah, okay. With the entire photo assembled, they are able to confirm what the Elysian box looks like. Unfortunately, right after that, a sudden gust of wind blows away a piece of the photo. How inconvenient. Pre-latent affirmations? Yes, we need them. We need them. I'm gonna give myself NHA exam affirmations. Two. With the rest of the photo in hand, they decide to make one more pass through town to find information. I'm too tired. I'm tired of running around this town. I'm tired of this town. I want to meet the vampire. Hello, Bob Marley. How are you? I'm gonna get chocolate milk real quick. Okay. Professor Layton, sir! Barton, my good man, whatever is the matter? The inspector has found the person responsible for Dr. Schrader's murder. I have strict orders to round everyone up at the hotel as soon as possible, sir. Understood. We will head there right now. Come, let's hurry. Yo, I'm ready to listen to this bullshit. But first I need to hear this. The professor and Luke decide to return to the hotel. Okay. Save your we just saved. Oh my god. Okay. Sorry. I'm just being stupid. The road to Hersian Castle. Ooh, we're gonna see the vampire soon? Okay. Return to the hotel. I was like, where am I going? I think I'm going the right way? Yes. Okay, BRB. Milk, chocolate, milk, chocolate. Nice. Okay, yeah. Go ahead. Ah, Mr. Layton. Shit, Mr. Bigweld, sir. What? What are you talking about? Ah, Mr. Layton, so glad you can finally join us. With you here, we now have every suspect in the murder of Dr. Schrader gathered in this room. What? We're a suspect? If he suspects us, I swear to fucking God, you don't get that. Oh, go to sleep, chef. Take care. Okay, I'll come say hi when I have time. Thank you for joining it. It was good to see you. Good to hear from you. I can't see you. Okay. A few days ago, renowned archaeologist Dr. Andrew Schrader was found dead in his London home. His murderer is still at large, but look around you. You could very well be sitting next to the culprit. A suspect? Me? Utter nonsense. What reason could I possibly have to kill a man I don't even know? A bit slow on the uptake, eh? Mr. Beluga, every person in this room is after the Elysian box. That box ties each of you to our dead man, so there's no doubt that one of you here did the deed. It's one of my favorite bits in the Layton series, the bit where the inspector is stupid. When is he not stupid? I don't think he's ever been not stupid. I'm sure putting this case together has been a triumph of police work, Inspector. So, tell me, what facts have you unearthed in these last few days? Watch closely now, Mr. Layton. This is how we unravel mysteries in Scotland Yard. You have my full attention, Inspector. Please, hypothesize away. I first learned of false sense through evidence obtained in the late doctor's office. According to his notes, Schrader spent quite some time in town researching the Elysian box. When I learned that he died shortly after returning home to London, everything came into focus. I believe our criminal first spotted the doctor when he was inquiring about the Elysian box here in town. Buying a chance to obtain the coveted box, the fiend followed the doctor to London and murdered him. Oh, now that's a deduction worthy of London's finest. So, out with it then. Who's our man? Hold your horses, I'm getting there. Summarize. The culprit must have been to Full Sense before. What's more, this person must have also had the ability to travel freely between here and London. Now, as we all know, only those affiliated with the Voluntary Express have that ability. And all eyes turn to Mr. Beluga, eh? Well, turn them back. Mr. Beluga stated he was in London conducting business that day, and his alibi checked out. Huh? But if it's not Mr. Beluga... That's right, our murderer stands before us. His name is Sammy Thunder! Okay. I really like this upcoming laugh. Oh no. What? You gotta be kidding, man! You know Mr. Beluga has ordered you to turn over every stone in this town to find the Elysian box. He worked you like a dog, and you resented that treatment. So you decided you'd beat him to the punch and make off with his precious box. This is an outrage! Samuel, what do you have to say for yourself? I'm being framed. You're out of your gourd, man. Now I see why the box eluded me for so long. You've been holding out on me, Samuel. Not great. No, I haven't. I swear on my favorite leather pants. Come on, Uncle, you know me. I'd never do anything that crazy. Gourd! Fucking gourd! You'll have plenty of time to tell me your story back in London from a cell. Now come along. So it was the conductor after all. I didn't think he had it in him, but at least we can all rest easy now. Shut the fuck up, Flora. I don't trust Flora. I think she's not Flora. Doesn't seem like herself right now, and it's fucking with my brain. Professor, do you really think Sammy could have committed such an awful crime? Well, all we have to go on is this single torn photograph recovered from the doctor's room. So that's the Elysian box? Wow, very fancy. I like the cute goat design on the top. Oh, she can tell it's a goat. Wait, that's weird. Why can she tell it's a goat? She's not supposed to be able to tell it's a goat. She should think it looks like a frog. I think that's very suspicious. I'm suspicious of her, okay? Rex used to tell me to shut the fuck up. Dang. I think it looks like a frog. Yeah, right? It looks like a frog. They even said it looks like a frog now. Why'd she say it looks like a goat? Suspicious. Oh my. Flora. Huh? Thank you, Flora. I knew something didn't feel quite right, but thanks to you, it's all come into focus. Huh? Really? You tell, Professor. Is there a puzzle?
Oh, come on, officer, man. My only crime is rocking. And rocking ain't a crime. Yow! Let me go.
Let me go. The voice acting. Yow!
You
Let me
come
go.
along quietly if you know what's good for you.
Bruh.
Just a moment, Inspector Chelmy.
Tell me. I've been saying Chenley. What's wrong? I can't read. Inspector Chelmy. Wowza. Just a moment. Inspector Chelmy?
I believe we've all committed a large and rather unfortunate oversight.
Can't you see I'm in the middle of something right now, Layton?
Chelmy, shut the fuck up.
Where are you going with this, Professor?
No one here has ever seen the Elysian box that we've been looking for. The one and only piece of visual evidence we possess is this torn photograph.
And? Get to the point!
Okay, I don't see where he's going with it.
The point is this, Inspector. The only person who could know what the Elysian box looks like is the suspect you're after.
I already saw where he was going with this. I'm stupid. And
it is this person who must have stolen the box in the first place.
Yes, and I've got the slippery fellow right here. Ow! Take it easy, officer!
Hindsight is 20/20, except yours might need glasses. Right. Don't be mean to me. I'm sensitive.
Pipe down, you hooligan!
Hooligan? He said that.
And watch the hair, will ya? Wow!
Dude, his hair is just like my hair. Just teasing? I don't even know what to say to that. I'm speechless. You already figured it out with the big chef brain?
But he's not the culprit.
Score. What?
What?
Stop talking in circles and get to the point, Layton.
Get to the point.
Who should be wearing the
Listen to this
handcuffs?
laugh.
Isn't it obvious? If the criminal does indeed reside in our midst, He or she would be the only one of us to see the Elysian box in person, which means the culprit. Must be you there.
Ah!
Flora!
Inspector, look here.
Uh-huh.
That's the photo I dropped. Indeed. This, for those who don't know, is a piece of evidence recovered by the inspector. It's a photo of the Elysian box, and I have every confidence that this shot depicts the real thing.
So, this little knick-knack here is what started the whole mess? To be honest, it's a bit outlandish for my taste, what with the bizarre frog head on it.
Right? It looks like a frog, doesn't it? Frog! Dude, she gave herself away so easy. I like frogs. Tomorrow I'm gonna get my frog onesie. It's gonna be great. What if I wear it for stream, just to show you guys?
Aha!
I see you've put the pieces together too, Luke. Inspector, the emblem decorating the top of this box depicts not a frog, but a goat.
A goat? Not by my eyes, it doesn't.
That's just it. This photograph is missing the piece containing the goat's eyes. In its current form, the image looks like a frog to most people, as was the case with you, Inspector. Flora, dear, I believe you said the design looked like a cute goat, did you not?
Highly sus. She's saying grr. She's been caught, girl.
Well, that clears things up nicely. If you say you saw a goat, that
Inspector
must
didn't
mean
look at the
you've
picture
seen
before it fell out of the pocket?
Elysian box before.
Well, it was already ripped. He just like didn't put it together because he's fucking stupid. He like didn't like piece it together. But why would he not piece it together? What kind of inspector doesn't piece together a torn photo? Where's the girl in my office who grew up? Excuse me? You mean to type that? Okay. Sorry. I'll pretend it never happened.
Who are you really?
I like her evil laugh.
Well played, Leighton.
Ew.
I'm
Sure, you're very proud of yourself for seeing through my disguise again.
How did he get small? It's me! Curse you, Leighton! Don Paolo! Curse you and that foppish hat of yours! He's back! Don Paolo! I beat you to the box and given a little more time I would have beaten you to cracking its secret. And of course the Hersian fortune would have been mine. But that ship has sailed now. You just want some money? So you're the one who had the Elysian box all along. Another brilliant deduction from Leighton's apprentice. Clearly he's learned from the best. Yeah. But yes, you're right, little man. I stole it off that old fool while he was snoozing on the floor. The geezer probably caught a cold sleeping on the ground like that. Not that I cared one iota. Snoozing? But Dr. Schrader wouldn't sleep on the floor. Wait a second. If you've been posing as Flora, then where's the real Flora? Oh, she's probably making hay angels with the cows in that old dropstone barn I left her in. Or maybe she's just sitting there fuming because you bumblers didn't even notice we switched places. But I must thank you two dolts for your help. You've given me more than enough information. The jig may be up, but the dance is far from over. I'm so close to unlocking the secret of the Elysian box. Now I need merely to take this box to the... Hold it right there, you scoundrel! Gah! I've got a lot of questions. You will answer them once I've escorted you back to London. Where do you think you're going? Ha! Got you, you slippery devil! Ugh, you meddlesome oaf! You have no idea just how slippery I can be! Ah! Don't just stand there, the worm's getting away! Fool, did you really think a soft-bodied flat-foot like yourself could catch me? So long, Layton. Scoundma! Think you can give me the slip, eh? I'll catch you yet! Oh, wait for me, Inspector! Soft-bodied. The curl at my... Excuse me? I'm starting to not be able to just let these things go. Wow, look at the three of them shake a leg. I didn't think they had it in them. I must say, I've never once suspected Don Paolo had been posing as Flora, and for so long. I sure hope the real Flora is okay. We absolutely can't forget to pick her up on the way back to London. Of course we won't. But I'm sure Flora is having a grand old time playing with the cows. Another thing I can't get out of my head is what Don Paolo said about Dr. Schrader. The way he was talking, it didn't sound like he killed Dr. Schrader. But if he didn't, who did? I think you're spot on there, Luke. Something else is responsible for the doctor's death. Right now, I'd say the Elysian box is the key to learning about that something was. Then I guess we've reached a dead end. If only Don Paolo hadn't run off with the... Professor, look! What? Well, look at that! Don Paolo must have dropped it when he was running away from Inspector Chenley. Tell me. He fucking left the box! Dude! How fucking convenient! That's too easy. That's rude. That's like an insult to my intelligence, to my capabilities. You know what I'm saying? But you don't think I can get it a normal way? You just have to give it to me? The fuck? So this is it, the Elysian box. At last, the box. Inside sleeps the key to uncovering a massive family fortune. I beg your pardon, sir? Mr. Layton, I'm going to ask you to hand over that box now. As a son of the late Duke Curzon, I am the rightful owner of that box. This box belongs to the Curzons? You hard of hearing, boy? Inside this box is the key to cracking the secret of the Curzon fortune. Seeing as how I share the bloodline, that box should pass into my hands and no one else's. Oh my, that does change things. I suppose we'll have to... Mr. Beluga, listen to yourself. You're no more entitled to that box than I am, nor any other person in this room for that matter. You listen here, Porter. This is none of your business, so I suggest you keep your opinions to yourself. No, I'm sorry, but I won't stand by and watch you claim that box as your own. If anyone has a rightful claim to that box, it's the current Duke of Fulsense himself. Current Duke of Fulsense? Besides, I've heard about you. You turned your back on this town and left of your own free will. In my book, your claim to the fortune was lost the day you walked out of Folsom. Oh, is that so? You've got some nerve, buddy. If what Krantz says is true, I'm afraid I can't hand this box over to you in good conscience, sir. Hey, Uncle, what do you say we give up on chasing this box? Keeping up stuff on the DL is exhausting. Don't you tell me how to run my affairs, Samuel. You've forgotten who signs your paychecks. The box is less important than it seems. Oh. It's just a box. It's just a box. Forget about it. I've never even wanted to be a conductor in the first place. Plus, paying errand boy is getting old, man. Playing errand boy is getting old. It's more than a guy like me can take. Sammy Thunder wasn't born to work a 9-to-5 gig. What the fuck? Sammy Thunder was born to rah! Hey, world, I'm climbing back on the rock train and riding it to the top. Yow! Huh? Samuel, what are you babbling on about? Come back here at once. He quit. Just the key to a fortune or some shit. I thought it kills you. What happened to that? I thought it, like, makes you die immediately. The fuck? I'm confused. I'm sorry, Mr. Beluga, but I think I'll have to hold on to this box for the moment. Fine, do what you want. I hope that awful box curses all of you twice over. Can you please yow? Yow! That's as much conviction as I can give. I mean, Dr. Schrader is dead. Uh-huh. Was it the box that killed him? What just happened? Box's location? So maybe, and Don Paolo didn't kill him, so maybe it's booby-trapped? Booby-trapped! What? Excuse- I'm just kidding. Tap a mystery for me. But it seems Don Paolo wasn't responsible for the doctor's death in the end. Maybe it really was the Elysian box's fault after all. Yes, it sounds like the doctor has already collapsed by the time Don Paolo arrived on the scene. Perhaps you're right, Luke. The box could very well contain a lethal element that killed the doctor. But without seeing the box's effect in action, how can we be sure? Surely you don't mean... I do, Luke. We must open the box ourselves. It's the only way. Bitch! Calm down, chef. Just because I said booby doesn't mean you need to go crazy. Boobies. Boobs. Breasts? Hibbies? Please just hold on a moment. Kadia? Kadia? Is there any way I can convince you to let me have that box? It's of vital importance. Before I do that, I would need to know more first. Why is this box so important to you? I'm sorry, it's not for me to say. But I must deliver that box to somebody important. I must. Who is this person? I can't tell you anymore, but once I'm done, I'm certain this awful curse will go away forever. The curse will end, and everything will be over and done with, and he'll... Whatever do you mean, dear? Help! Somebody! Anybody! Come quick! Somebody else just got taken away to Herzen Castle! The vampire's gonna suck his blood and then he's gonna steal his soul! Why did it have to be him? Why? He was such a stand-up guy, too. What? No, that's impossible! What is happening? Why would you not open it using like a remote control bomb disposal robot? It's a little dumb. I know, I'm like, why do you want to open it? Wait, Kadia, where are you running off to? The vampire! We're gonna see the vampire? Oh, hell yeah, dude. I'm excited. Wow, she sure left in a hurry. Maybe all that vampire talk scared her. Scary horror game now. Yay. I'm scared. Maybe I cannot play anymore. Dude, I feel nauseous. I feel nauseous. I'm gonna fucking die. We haven't had a single puzzle. It's been 30 minutes. And we haven't had a single puzzle. What the fuck? Do you know what she was talking about? I feel like I could only follow half of what she said. There's so much reading for me to do. I'm as confused as you are, Luke. But after our discussion, I'm doubly sure now that this box contains a greater secret. The path to understanding everything lies right before us. While potentially perilous, opening the box seems to be the only course of action left to us. Understood, Professor. Good, then let's take this to our room so we can open the box away from prying eyes. Professor and Luke decide to head up to their room in the hotel. Okay.
Finally, the Elysian box.
Indeed, Luke.
At least open it like facing away from you. You know what I'm saying? Like, what are you doing? He's sweating.
No, 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 no.
Huh?
Huh?
It's empty! Like he's gonna shit his pants.
Box is empty, and we're still alive.
Bruh. The killing device is gone. Whoa, just like Kung Fu Panda Dragon Scroll. Bro, literally the same thing. The secret was the friends we made along the way.
Then it would seem my theory was correct.
What was your theory? Do tell.
What do you mean, Professor?
That's not what Kung Fu Panda was about. The secret was inside of you all along. You were able to do what you thought you could do. I don't remember what the secret was. Sure. Nice, okay. I must head back into town and do a bit more asking around. I need to confirm my suspicions. I hate asking around. The professor and Luke decide to look around Folson's for more information. It's not about friends. We don't need friends. What? Why are you against friendship? I'm not upset about the puzzles. I'm upset about having to fucking navigate. I hate the way we move in this game. Actually, let's ask this guy. Good evening, sirs. Please forgive my outburst earlier, but that wasn't very professional of me. Not at all. Your testimony was incredibly helpful. Listening to you talk, I got the impression you were well versed in the Herzen family history. Well, I suppose you could say that. When he was still alive, Duke Herzen often favored our fine hotel with his patronage. Excuse me, sorry. I have very warm memories of his kindness towards me even when I was just a lowly bellhop. Back when the Duke was still with us, the whole of Folsense buzzed with energy and activity. But once the mining stopped and the Duke passed on, our town turned into quite a gloomy place. Except when she has to watch lore instead of puzzles. I haven't done puzzles in years! Wow, the butler burped. Kind of weird. Butlers can burp, okay? They're allowed to burp. After his passing, who stepped in to take his place? Did he have any children? As I recall, Mr. Beluga's brother stepped up to take the Duke's place. That's really all I know about the situation, though I've heard our current Duke is quite young. And on the vampires' rumors, which I'm sure you've heard, and you know everything I do. Add on the vampires' rumors. No, they're not. That's kind of a big part of the job, no burp. They're not? What? They can't burp? I didn't know that. It's crazy. Yow! It's my main dudes. You're the only reason I didn't catch that bogus charge. To say thanks, I pulled some strings with the museum curator and got him to open the place up for you. Not much, but maybe you'll find some righteous info there to help your case. Make sure you check it out. Thanks, Sammy. It got pretty hairy back there for a little bit, didn't it? I still haven't gotten over discovering that Mr. Beluga is actually part of the Herzen family. Yeah, my uncle never really told me much about it all. I just know he had some kind of blowout with his dad, the Duke, and decided to leave for good. He did talk a lot about the brother he left behind, though. He has a real soft spot for the guy. But now it looks like that gnarly vampire's running around the castle. I hate to say it, but I doubt anyone survived that wicked, scary monster moving in. Diary key! Nice. Their access guaranteed, the professor and Luke decide to visit the Herzen Museum again. Folsense used to be home to many families of noble birth. Then Duke Herzen discovered a vast gold deposit on the outskirts of town, which changed everything. Folsense developed rapidly, but the word of the gold brought in all sorts of unsavory types. It's such a shame. This used to be such an enchanting town. No puzzles, come on. Can you believe that girl left Folsense just because some boy dumped her? What a wimp. Okay. Derby, boy, you two sure run around a bunch, huh? You'd never catch me doing that. I'd get all sweaty. Okay. Oh! My ex dumped me. I'm sorry, XLR. No one in this town ever wants to do anything with me, so I'm always all by myself. It stinks. What do you say, mister? I know a pretty good game called Solve the Puzzle. Wanna play? Nice puzzle. Puzzle. 30 pick-a-rats. Okay. A number of identical cans are hanging from a tree. While all the cans here may look empty, one is actually filled with water. Huh. See if you can find it. When deducing your answer, ignore the weight of each string and stick. Okay. I'm thinking it's A.
And now to test my theory. And there we have it.
Easy peasy. Come on. 30 picarats? What the hell? Like, come on. Give me something harder. Okay. I knew that puzzle was going to be too easy for you, but I'm just a kid, so what did you expect? I don't know any harder ones, but some of the grown-ups in town might. Nice. Oh. Sorry, I didn't mean to call your puzzle too easy. Okay, I apologize. She wants tea. I don't want to. You insulted that kid? I'm sorry. I apologize. He was so polite too. Look at you two running around and around town like a dog chasing its own tail. Actually, watching you reminded me of a fabulous puzzle I know about dogs. Listen up. Okay, let's see how. 50 picarats! Maybe this one's gonna be hard. Okay, a girl takes her dog out. At first, she carries her dog for 10 seconds, but then her dad steps out. At this point, the girl sets her dog down and keeps walking. The dog immediately runs over to the dad, and upon reaching him, he turns around and runs back to the girl. The dog keeps doing this until the dad catches up with the girl. The dog runs at 5 feet per second. The dad walks at 2 feet per second, and the girl walks at 1 foot per second. How far does the dog run by the time the dad catches up to his daughter? Bruh. Well, I asked for something hard. That made my eyes itch. Okay. Okay, let's take it from the top. So, she walks with her dog, so she's holding the dog, and she walks for 10 seconds. If she's walking at 1 foot per second, that means she gets 10 feet away. So she gets 10. 1, 2. Okay. At this point, the girl sets her dog down and keeps walking. The dog immediately runs over to the dad, and upon reaching him, turns around and runs back to the girl. The dog keeps doing this until the dad catches up. The dog runs at 5 feet per second, so it takes him 2 seconds. Takes him 2 seconds to get back to the dad, but the dad is walking at 2 feet per second. So that means he's 4 feet by the time the dog gets to him. 1, 2, 3, 4, 5. Okay. 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 And then oh wait, no, hold on, I fucked up. I need to start over. Hold on, I have to take it 1 second at a time. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, and then the dog runs back for a second. I'm like struggling here. There's probably like a math way for me to do this, but I can't do math right now. stream is chugging a bit. Really? Aw, I'm not even doing anything. It's weird when it chugs when I'm not like doing anything. I guess it like. Okay. 1, 2, 3, 5. Five, 10, 15, 20, 25, 30, 35, 40, 45. They've been having trouble recently. Oh, it could be Twitch actually. I've been having trouble. Oh, that's lame. I don't know, man.
This should do the trick. Oh, my. This one is
Are you sure you're
quite
overthinking this
formidable.
one? Probably. There has to be a simpler way to do this. It's 10 feet away. Ugh. Okay, so it takes him 5 seconds to get to the 10 feet. And then by that time, she's 15 feet away. It takes 2.5 seconds to get there. I'm confused. How long did... 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Give him 10 seconds to get to her?
Consider this puzzle solved.
One thing to think about is the
And
wording
there
of the
we
last
have it.
sentence, the question itself. Yes. Because he's continuously running at 5 feet per second, the dog. Right? So I just had to figure out how long it takes the dad to get to the girl. And that's how many seconds to multiply by 5. So. The reason I put 45 was because I forgot to count the last one. I had like a whole like thing going on where I was like writing, like I was putting how far they ran and how far like is like 2 feet, 2 feet, 2 feet, 2 feet per second. And then I had like the I don't know why I included the dog for no reason, but then the girl is at the bottom. 1 foot. But yeah, that was how I figured out it was 10 seconds for him to get to her, but oh, nice work, you two. You guys run around like dogs, but you've got it going on upstairs too, don't you? If you both love running around so much, I won't stop you. Besides, it's fun to watch. The Elysian box has such a nice ring to it. What genius came up with that gem of a name? Okay. I've never seen anybody go to so much trouble to get their mitts on a piece of garbage. Puzzle, maybe? My name is Gregorio, and I love chess like mice love fancy cheese. If you can solve this little chess puzzle I've set up, I'll tell you what I know about full sets. That sounds fair. Show me what you've got. 50 Picarats. Lead the knight on a trip around the board below. Chess knights move the knight around the entire board, landing on each square only once. Ah, man. Ugh. Yeah!
This should do the
That was
trick.
kind of harder than the first one.
A true gentleman leaves no puzzle unsolved.
Well done. Thank you. Sharp thinking, sonny boy. Real sharp. And what was I going to say? Oh yes, the Herzen. Way back when, the Herzen Castle used to be quite the hot spot. The rich folks would just throw walls there. Now though, no one will go near this place. This castle's supposedly got a vampire living in it. But I wouldn't give for things to go back to the way they were. Welcome, friends. I'm Grinko, and I'm the curator of the Herzen Museum. We have an extensive collection of artifacts pertaining to the history of this town and the Herzen family. Amy told me all about you two. I hope you find our resources helpful to your search. Please feel free to peruse the collection to your heart's content. The professor and Luke decide to explore the Herzen Museum. Okay, so we've gotten to the Herzen Museum, but would you look at the time? It is late. Just about time. I'll have work tomorrow. But I start work an hour later on Saturdays. Eyes were itchy. Just as the title says, I am exhausted. Can I just sleep right here? Oh, did my sister reply? Oh, they got a Christmas tree. So cute. Transferring funds. Sigh. Ah! I dropped my pen. Okay. I don't have anything else to say to you guys. I will probably stream tomorrow, maybe a little bit earlier than today because I'll get home a little bit earlier. We're gonna start with studying and then go on to like chilling. Stretching good night, Chef. See you tomorrow, Chef. Excuse me. I'm tired. Yeah, I'll see you guys tomorrow. That is all. I don't have anything else. Okay? Goodbye, guys. Goodbye. Goodbye. Goodbye.